Hello, my name is Jari Kempas. I'm a health economist. In this video, I'm going to present you an investment case for business planning in primary healthcare in Tajikistan. I will highlight the benefit of a business planning process and assess the cost in a well-performing Konibajam Rayon. In this case study is aimed to attract financial support from international donors and also to advocate Ministry of Health to increase national funding for business planning. This investment case is available as a PDF both in English and in Russian. National adaptation of business planning practices is currently ongoing. However, the implementation relies heavily on international financial support. Project Sino and its STC funding will end in March 2021. This poses challenges to the continuity of this effective planning practice. The business planning process is a management tool that aims to improve efficiency of services and management practices and raise awareness of available resources and increase transparency at the primary healthcare level. The overall goal is to improve access to sustainable health services for the wider population, with particular attention to the inclusion of vulnerable groups to the services. The Konibajam Rayon was selected for the case study with the following criteria. First of all, it is a well-performing rayon. The business planning process has been implemented there over 3 years. It has an effective and motivated primary healthcare management team. There's an ongoing cooperation with the community health team and Healthy Life Services, and all the doctors and nurses have completed family medicine training. And finally, it is also comparable with other rayons in terms of population size and the mix of rural and urban populations. Then the benefits of business planning. According to a recent external assessment by the WHO Country Office, the business planning practices improved health outcomes, increased transparency of the health facilities' activities and resources, increased management capacity, and improved community engagement. Moreover, the rayons with the donor support were reported to perform better. Next, the cost per rayon. In the well-performing Konibajam Rayon in 2019, the business planning costs were $6,100 per year. 90% of this was financed by the Sino project and STC. Here is a breakdown of the cost. 33% was used on meetings, 31% on incentives, 19% on travel cost, and 14% on salaries. The business planning department of the Clinical Center of Family Medicine is responsible for the coordination and supervision of the business planning process in the entire country. Due to its small size, only 3 persons, it has a limited capacity to take care of these responsibilities. In 2019, the annual budget was $18,900, of which 66% was financed by the Sino project. The implementation of business planning relies heavily on external support. In 2019, 17 rayons were supported by international organizations, 9 by Aga Khan Health Services, 7 by Sino Project, and 1 by the WHO Country Office. And 16 rayons were supported by the local Oblast trainers. The external assessment by the WHO Country Office clearly demonstrates the benefit of business planning in Tajikistan. Training and motivation of primary healthcare management teams alone is not enough. Budget needs to be allocated for the business planning activities. International funding is urgently needed, and the current donor-supported funding structure is too expensive to be sustained and scaled up with national financing. Here are the recommendations. First, international financial support is urgently needed. The implementation of an effective business planning process requires an annual investment of $6,100 per rayon. Second, the Ministry of Health should start to allocate budget earmarked for the business planning activities at the oblast and rayon levels. and to commit to increase this investment. Third, one should explore what the minimum business planning activities and the required budget are for a realistic transition for domestic financing. Fourth, strengthen the coordination capacity of the business planning department by increasing both its funding and human resources. And finally, fifth, continue national scale-up of the business planning according to the 2014 order, while focusing on improving the coordination and quality of the business planning process. I would like to thank all these persons for their support with this study. Thank you for watching.